Dr. Ken Landau. Thanks for watching. Let's talk about the COVID long haul syndrome. This occurs when patients are infected with the COVID-19 virus, and then they don't seem to improve after a period of about 2 weeks. Conditions now generally accepted, originally met with a lot of skepticism. JAMA, they report that at least 10% of people going to become long haulers. Initially, we thought that it would occur mostly in people who were inpatients in the hospital receiving oxygen therapy, the sickest of the sick. But now we know you could be an inpatient or an outpatient. You know, you can be young or old. We know you can be otherwise healthy when you're infected, or you could carry some baggage, some medical diseases. Everybody seems to be relatively equally susceptible. We don't understand the natural history of the disease, and it seems that some, not all of the people, are going to improve after a period of about 4 to 5 months, but some with symptoms going to last for in excess of a year. Now, most of the time when you're infected with any viral infection, especially with COVID, well, it seems that you get better in a period of 2 weeks. But when we're talking about the long haul syndrome, people may tend to initially improve, but then the symptoms worsen. They become persistent, or they can become cyclical in nature. They can come and go. You can have periods when you're otherwise healthy and periods when you're otherwise symptomatic. And now we know that the original infection might have been totally asymptomatic. So we don't have that guidepost to say that the symptoms that we now find are related to the infection when we don't know that the initial infection existed. Well, the name originally, long haul syndrome, came from an American woman who started a support group. She was wearing a trucker's hat and it said long haul on it, so that's the genesis of the condition. NIH recently changed the official name of this condition to the post-acute sequelae of SARS coronavirus 2, or PASC, P-A-S-C. Dr. Fauci at the same time announced more than $1 billion initiative to come to some understanding of what's causing the condition and what we can do about it. But at the present time, we don't have a lot of information about the condition, since obviously it's a relatively new virus. All we can say is that with most viruses, you get better after the initial infection within a period of about 2 weeks. But here you don't, and here we don't have any kind of specific diagnostic test to say it's related to the initial COVID infection, and we have little to guide us as far as the therapy is concerned. Now, about half of the people who have this long haul syndrome, they never had an acute initial test, so they didn't know that they were infected. Could have been asymptomatic, could have mild symptoms. And now all of a sudden, at some point in time, they develop some of these chronic conditions that sound kind of peculiar. So a lot of doctors were initially skeptical. They thought that people might have secondary gain in mind, or they thought that some of the women were hysterical if they had the symptoms. And people would show up at their doctor's offices, the family doctor, the internist, maybe they would see the neurologist or the cardiologist, gastroenterologist, all with symptoms that are non-specific. And there was nothing to link them back to the initial COVID infection. Well, when the studies were initially done, the studies looked at the people who were in the hospital with acute infection, and then they followed them at some period of time, but they examined them only one time. So we don't know if the symptoms were persistent, if they tended to get worse after recovery. We didn't know if the patients developed new symptoms after they were discharged from the hospital. Didn't know if the people who were sicker or people who were less sick developed symptoms that were different. Now we know a lot more about the condition. But there's a lot of question about the disease, and now it's thought that maybe the people who have what we now call the long haul syndrome are actually suffering from the myalgic encephalomyelitis chronic fatigue syndrome, sometimes just called chronic fatigue syndrome, sometimes just called myalgic encephalomyelitis. But we can simplify the name to post-viral fatigue syndrome. It's not a new syndrome. We know that it can occur after a variety of viral infections. So it occurred after the Spanish flu in 1918. It occurred after the swine flu, the N1H1. It occurred after the initial SARS infection, the original in 2002. Some of the people were symptomatic for at least 15 years after that infection. MERS, related to coronavirus infection, can have these kind of symptoms. But you could get the symptoms after the common acquired pneumonia or encephalitis or Zika disease. You can get it after Guillain-Barré syndrome or Epstein-Barr syndrome, the chronic mononucleosis, or mononucleosis, you can say chronic. You could get it after the acute respiratory distress syndrome, Ebola. All of those may lead to this kind of condition, but we don't know a lot about the course. We don't know if or when people are going to return to the baseline. What we can say is with most viral infections, you feel awful for 2 or 3 days. You know that from the flu. Then you feel better by 2 to 3 weeks. Here, you don't. We know that some reports suggest as many as 20 to 35% of people between the ages of 18 and 34 aren't going to regain their normal condition of health after 2 or 3 weeks from the time of the infection. We know that the syndrome initially, if we look at all the people, seemed to have an average age of about 44. And now, whether you were fit or unfit, that doesn't seem to have anything to do with whether you're going to develop the symptoms. If we're talking about the myalgic encephalitis chronic fatigue syndrome, we can say 800,000 to 2.5 million people in the United States may suffer that condition. About 90% of the people with the condition have not yet received the diagnosis. You can learn more about the condition if you watch one of our earlier shows specifically on that topic. It was thought that risk factors for the long haul syndrome were more prolonged or severe illness, chronic psychiatric condition. Thought the older you were, maybe women more so than men, people with asthma, people with hypertension or obesity. Those people, especially if they had pre-existing lung disease, seem to be especially susceptible, but now we know that that's not really the case. We know that everybody seems to be relatively equally susceptible, including people who have a lack of resilience, people with depression, people with anxiety. We know that there might be some genetic predisposition to the condition, and it was originally thought that the more severe the acute illness was, the greater the pulmonary involvement was, the more you needed the oxygen, the greater you were at risk. So initial reports came out and showed that about 60% of people developed the long haul syndrome if they were hospitalized and required mechanical ventilation, as opposed to 20% of people who didn't require the oxygen treatment. Now we know that those early numbers were because of skewed population. We know that the initial studies were of hospitalized patients. Now we're looking at people who are principally outpatients. Well, the toll of coronavirus is substantial. In the world at the present time, we have more than 120 million cases and more than 2.5 million deaths. In the United States, more than 29 million cases and more than 530,000 deaths. And just to give you perspective, if you look at just LA County by itself, Los Angeles County has, at the present time, more than 1.25 million cases and more than 22,000 deaths in that one county. And that means if we're going to have 10% or more of people with the acute viral infection developing long haul syndrome, it means that we might have hundreds of thousands of people who have this condition, and we don't have any specific tests, and we don't even know what to do with them. So in one example in JAMA, again, Journal of the American Medical Association, there was one case where the patient had stabbing pain in the chest, so severe it caused the patient to cry, went to the emergency room. 5 months later, the person had been to the emergency room or seen doctors at least 16 times, been hospitalized at least 3 times, and had brain fog where they couldn't remember words, couldn't keep track of the medicines. So the symptoms that are associated with long haul can be different than the symptoms that you had when you were first infected with the condition, whether you were hospitalized or whether you were treated as an outpatient. Symptoms don't necessarily have to be the same. And as I mentioned before, some can have better days, some can have worse days, but the people just don't feel like themselves. They don't have that same ability to be active. About 70% of the people are relatively sedentary after infection versus the same 70% were active before the infection. So the symptoms wax and wane over time. What are they? Well, the symptoms are nonspecific. Coughing, shortness of breath, sometimes debilitating fatigue. That's one of the major symptoms. You could have body aches or joint pain or chest pain. Some people have the loss of smell or taste. And that's even if they didn't have the loss of smell or taste during the acute infection. Maybe a sign of the long haul syndrome. Some people have difficulty sleeping, insomnia, or headache. Well, some people rarely may have fever, but most people don't. Some people have sore throat, runny nose, nausea, diarrhea, ear pain, rash. Some people feel feverish, even if they don't have an elevated body temperature. Some people have night sweats. So you can see where the people can be misdiagnosed. Those are just absolutely nonspecific symptoms. Easy bruisability, sensitivity to light and sound. We know that even if people didn't have any kidney problem at the initial infection, they may develop acute renal injury later during their COVID-19, the long haul syndrome. Some people lose their hair, some people have mood changes, and then they present to the doctor and they ask the cardiologist and the neurologist or the rheumatologist or the dermatologist to make the diagnosis based on the symptoms that they have, and nobody can link those back to the initial COVID infection. Well, fatigue, when we talk about that, major symptom, it's not like the fatigue you get from having a bad night's sleep. The fatigue rather is much more profound. Often you feel like you need a nap after you just go walk the dog, or if you go up a flight of steps, or if you use the vacuum. It may be exhausting. And you have difficulty concentrating oftentimes. You watch the television, but you forget what happened, and you can't perform simple calculations. Some people struggle to breathe, even though they have normal oxygen levels. And that struggling to breathe, the extra effort in respiration leads to fatigue sometimes. Difficulty of breathing and shortness of breath go hand in hand. Some people have deconditioning because they had a long acute illness. Some people gasp for air several times. Some people have infection-specific conditions. Maybe they have post-viral reactive airways. So just if you had the flu or if you had any other kind of condition, then your airways tend to be reactive, especially if you have a history of asthma or atopic condition. Some people develop some scarring in the lung fibrosis, scarring in the heart, myocardial fibrosis. Some people can develop post-viral heart failure. Now, in New York City, cough is the most common presenting symptom of the long haul syndrome. And it seems that a lot of people develop this brain fog that people are talking about. It's unusual forgetfulness. People are confused. They're unable to concentrate, unable even when they watch television to know what's happening. Now, these symptoms are highly suggestive of myalgic encephalitis, chronic fatigue syndrome. And as a matter of fact, 3/4 of the people with that condition, the myalgic encephalitis, chronic fatigue syndrome, can begin after a viral infection. And as a matter of fact, the International Disease, the ICD, in the International Classification of Disease, they refer to myalgic encephalitis, chronic fatigue syndrome as a post-viral syndrome. But a lot of people refuse to believe that. And some people, about 7%, can develop some psychiatric conditions, delusions, or hallucinations, awful hallucinations. These people tend to be mostly in their 30s to the 50s. But remember, it's very rare for people to develop psychoses for the first time in middle age. Most of the people develop it with schizophrenia in relatively early age, late teenage, early 20s, or they develop it when they have dementia. And some people who have the long haul syndrome are aware that there's something wrong with their thinking process, with their mental process, as opposed to people with schizophrenia who are totally unaware that anything's wrong. And some of the patients who have some of these conditions, psychiatric conditions, are diagnosed with acute ADHD or maybe even panic attacks. And that's in spite of the fact that brain scans and spinal taps and all of the other tests that are done show no specific abnormality, yet the patients still present with numbness or tingling of the hands or feet, or pins and needle sensation, or vertigo, or headache. Sometimes they have low back pain or stabbing pains, stabbing migraines. They have a decreased sense of smell. They can have peculiarities in the sensitivity to taste or smell. Things that used to smell quite nice now all of a sudden can take a rancid or a putrid type impression or cause the impression? Well, anosmia, or lack of smell, can occur in as many as 18% of these long haulers. And it's important because the sense of smell is a sense that we use for alarm. So burning food on the stove, or a gas leak, or sometimes spoiled food, or ammonia fumes. And because we can't have that normal sense of smell, it can change the pleasure with eating, and mood, and memories, and quality of life. Well, the Lancet in January of 2021 said that somewhere between 50 and 60% of the people with chronic long haul are going to have fatigue, about 60% going to have muscle weakness, about 40% shortness of breath and dyspnea, and about 25% are going to have some sleep difficulties, some problems with joint pain or anxiety or depression or chest pain. And a significant number of those are going to develop the acute renal injury that I mentioned, about 10-15%. And we know that depending on the different populations that are studied, an average can be, in some studies, that maybe 13% of the people are going to have symptoms for more than 4 weeks, and that can dwindle down to 2% after a period of about 12 weeks. But that seems to be relatively low, because studies in Italy show that 87% of people are going to have symptoms at 2 months, and in the United States, in the United Kingdom, and in Sweden, this studies suggest that maybe the symptoms can last for 3 to 6 months or even longer, and the Mayo Clinic says, well, they could last for a year or longer. Now, the good news is that many people seem to feel better after a period of about 4 to 5 months, but that's tentative and it's variable, and it's not guaranteed that you're going to feel better. Well, on the other end of the spectrum, in China, in January of 2021, the Lancet published an article that evaluated an initial group of 1,733 patients who were hospitalized. And they studied them for long haul after a period of about 6 months, and they found the incidence in males and females was pretty much equal, but they found that 75%, 3/4 of the people who had the acute infection were still going to have symptoms after a period of about 6 months, and that didn't include people who were the sickest of the sick. So there were only about 4% of the people who were in the intensive care unit, yet 76% of all the patients seemed to have symptoms that persisted for at least half a year. And the Centers for Disease Control reported a study that looked at 14 academic centers here in the United States, and they found that a significant number of the people had at least one symptom somewhere between 2 and 3 weeks later. That was 94% of the people. And it seems like the symptoms occur, if we look out over a period of time, in an increasing number the older we get. There's no racial or ethnic predominance with the condition. Now, we have another report that reported 91% of the people didn't fully recover by day 40. They were still complaining of the same kinds of symptoms, the fatigue and the chills and the sweats and the body aches and the headaches and all, the brain fog. And we know that if we look over a period of time, there's going to be a significant number of people whose symptoms just go on and on. Probably the best study was published in JAMA. It was from the University of Washington in February of 2021. And what they did is they looked at 234 patients, and they followed them. They followed them for a period of 3 to 9 months after the acute illness. The average age of these people, 48, but they ranged anywhere between about 18 and 94 years of age. A little more than half of the people were women. And what they found was that persistent symptoms occurred in 27% in the 18 to 33-year-old group, 30% in the 40 to 64-year-old age group, and about 43% in the senior citizen group. So it seems like the symptoms are going to last a long time. What causes these symptoms? We haven't the slightest idea. Some people say it's an immune reaction, a vascular reaction, a surge in the inflammation, residual small amounts of viral particles, not the whole virus, but maybe some of the antigens from the virus that are left over. Maybe it has something to do with the damage from the lungs, the initial infection, even though a person might have normal oxygen levels, might have thickened air sacs and fluid accumulating in the air sacs. It makes it harder to breathe. Maybe there's something wrong with the cells lining the blood vessels, the endothelial cells, maybe the mitochondria. The portions of the cell that make the energy, maybe they're dysfunctional. Some people might be an autoimmune condition or blood clotting, persistent low-grade infection, although most people say that they can't find any evidence of that, dysregulation of the autonomic nervous system, all sorts of ideas, maybe even mast cell activation, maybe a small fiber neuropathy. But it all boils down to we don't know, and the best choice at the present time, not necessarily a year from now or 3 years from now, but right now, most people are going with the idea that the symptoms are consistent with myalgic encephalomyelitis, chronic fatigue syndrome. But we still have a lot of employers who say that they don't believe that the symptoms last that long. They think that the people are showing symptoms of stress or anxiety, psychiatric problem, maybe they're using drugs. So it comes down to what do we do to prevent the condition from beginning in the first place? Well, right now it's still the social distancing and wearing the mask, wash your hands. But now we have the vaccine. So I've already had my vaccine. I'd rush out and get it if I were you. If you haven't had the vaccine, a lot of ideas about treatment, none of them have panned out. There's a recent suggestion that maybe if you receive the vaccine after you've started to develop some of the long haul syndrome, maybe the symptoms can decrease or disappear. Those are just what we call anecdotal. There's no specific medical study, but you've seen reports in the news over this condition, vaccination making the symptoms go away. It might work in some people. Should have the vaccine anyway. But now we have specialty clinics that are being set up in major medical centers throughout the United States, throughout the world, to study this condition. Hopefully we gain some more information. And that's unfortunately the sad state of affairs with this long haul syndrome. Non-specific symptoms can persist or come and go. No idea of what the underlying cause of the condition is. We don't know that it has to do with faulty immune system or blood clotting or some other kind of a mechanism, but the bet right now is myalgic encephalomyelitis chronic fatigue syndrome. The new name, the post-acute sequelae of SARS, coronavirus 2 infection. Tell you what, if you haven't gotten the vaccine, the best thing you can do is just go get the vaccine. You don't have to worry about the names. You don't have to worry about anything else. Because if you do get the infection, even if you're asymptomatic, you might have symptoms that last for 4 or 5 months or even longer. And it's not worth it. Just go get the vaccine. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. Appreciate your interest. I'm Dr. Ken Landau.